Globally, over 55 million people live with dementia, but up to 85% of people living with dementia may not receive post-diagnosis care. This was revealed in the latest report by Alzheimer's Disease International. We speak to its CEO, Paola Barbarino, on why there is a lack of urgency to address this condition.
In general, I think one of the biggest challenges we have is stigma. So a lot of people still don't believe that Alzheimer or dementia are diseases. They still believe it's caused by normal aging. But if you see the brain of a person with Alzheimer and you take the brain of a healthy person, they are completely at the same age, they're completely different. So it's just an organ that shrivels, just as other organs in your body could shrivel. So it is a disease. And if government don't accept that, if clinical practitioners don't accept that, in our survey in 2019, we discovered that 62% of healthcare practitioners still believed dementia was part of normal aging. So this is still the challenge. So people need to stop being in denial that this is going to go miraculously away. It's not.
With the number of dementia cases expected to continue on an upward trend, Paola stresses the importance for a national plan to be put into action.
Malaysia has been working on its national dementia plan now for quite some time. Unfortunately, COVID blocked the development, and the plan, as far as I know, has been sitting in an in-tray at the ministry for a long time. However, we have very positive news. We've just been granted a meeting with the Minister of Health in October. So we are very hopeful that this is a positive signal that the ministry may be interested in picking up the plan and doing something about it. I also know that the minister himself has recently announced that sadly his father-in-law, the former prime minister, has developed dementia. And that is really an important thing to do, because it will make more Malaysians that are going through this difficult time aware that this is something not to be ashamed of. This is something that can happen in any family. So the plan in dementia is a good plan, the draft plan. It just needs implementation by the minister and even better localization to the needs of Malaysia. And the important thing is that plans are expensive, it's true, but you don't have to start with a big plan. You can start from somewhere and then expand your plan to cover other areas.